I'm Reagan Carter, and welcome to My Health, My Life, Planned Parenthood's new public affairs program right here on WBOK. Louisiana is facing many health care challenges, and this show is dedicated to raising awareness, but most importantly, to have a discussion with community partners and experts from across Louisiana about solutions for making our state a healthier one. Did you know that half of all sexually active young people in the United States will contract a sexually transmitted disease by the time they're 25, and that most of them won't even know it? If not treated, STDs can lead to serious health problems. Untreated STDs like chlamydia, although are easy to cure, can definitely cause difficulty if a woman becomes pregnant. Having an STD like herpes or gonorrhea can also increase your chances of getting HIV. April is STD Awareness Month, which is an opportunity to raise awareness and for us to take care of ourselves, our health, as well as our communities. Joining us for this conversation are Reverend Darcy Roake, a Unitarian Universalist minister, and Reverend Dwight Webster of Christian Unity Baptist Church. Thank you both so much for taking the time to tackle this extremely important topic with us today here on My Health, My Life. Reverend Webster, please tell our listeners about yourself. How long have you been a pastor here in New Orleans?
I'm the senior and founding pastor of Christian Unity Baptist Church on Claiborne and Conti. We just celebrated our 26th anniversary, and I pastored a couple of years before that, and I came here originally to be university chaplain and assistant professor of religion at Dillard.
Wonderful, wonderful. So a great expert here with us today. Louisiana ranks in the top 3 for rates of infection for chlamydia, gonorrhea, and syphilis. And New Orleans has the 3rd highest rate for new HIV diagnoses in the nation, and Baton Rouge has the 2nd. Reverend Webster, can you please tell us how you address these real-life issues within your ministry?
Well, it's not an easy thing, and thank you for the opportunity to share because it is a complex situation. As you may well know, as a pastor, I run into people who become pregnant, and I say people, it's not just the female, but the male is also involved in that. And rather than words of judgment, my first words are generally, have you seen or sought out medical care? I was kind of horrified to find out that there were young ladies who had gone all the way into the 3rd trimester of their pregnancy and not had any kind of prenatal care, which jeopardized both her life and the life of the life living in her. Whereas I don't compromise on my principles, but one of those principles is the life and the health and the viability of everything that's living.
Wonderful. Thank you so much for that. We certainly agree with that. And in Louisiana, one of the healthcare crises that we're dealing with is women in Louisiana tend to not seek that prenatal care, which in turns we have some very high rates of infant mortality as well as maternal mortality for those pregnant mothers. And so thank you for bringing up that important issue. We also have with us Reverend Roake, and Reverend Roake is a Unitarian Universalist minister. Can you explain to us how in your religious tradition you address some of these same issues?
Absolutely. And also personally, I have to say, as a Unitarian Universalist minister and a new mother myself, it's very telling right now. I'm wearing my clerical collar, and I also have pants that before I was leaving my house, my son spit up on them. So it kind of talks about really the real life issues that we're facing. And for me, for Unitarian Universalists, we believe in the idea of the inherent worth and dignity of every human being. And in that, we believe that as well that individuals have physical bodies, that they have the divine spark of God within them, and that they have the faculties of reason that's been God-given. And so how do we best support that in a just, equitable, and compassionate way? Unitarian Universalists do that. One specific way is that we've had a curriculum since 1970s that's advocated for and provided age-appropriate, medically accurate, comprehensive sex education. It was developed in collaboration with the United Church of Christ. And we believe, which I know that Planned Parenthood also has a similar curriculum, so we believe that those kind of curriculums dismantle stereotypes and assumptions, and they build self-acceptance and self-esteem, foster healthy relationship, improve decision-making, and have the potential to save lives. So that's one area where Unitarian Universalists believe the idea of education and advocacy. We also believe in the idea of reproductive justice and freedom. The Dallas Unitarian Church, in 1969, the Women's Alliance of that church were the individuals who supported Virginia Whitehill, who went on a journey towards presenting oral arguments before the Supreme Court for Roe versus Wade. So we also believe in that a woman's choice is with her family, her faith, and her community, and we want to help support women in their choices and in helping to raise the children that they do have.
Thank you so much. Very important responses from both Reverend Webster and Reverend Roake. And both of them are members of Planned Parenthood's Clergy Council, which is an advisory board of faith leaders from across New Orleans of various spiritual doctrines who recognize and bear witness in support of reproductive health, reproductive rights, and reproductive justice so that the public may understand the theological and moral basis for education and advocacy efforts in support of reproductive issues. Thank you so much for both being here and for your involvement in this work. Your voices are certainly an important piece of the fight for reproductive justice, reproductive health care, and access. If you're interested in joining the conversation, please join us online or follow us on Twitter at pplouisiana, and please don't forget to use the hashtag #MyHealthMyLife. Planned Parenthood offers community sexual and reproductive health education programs, as well as programs that teach parents how to talk with their children about sexual health. Reverend Roake, can you please speak a little bit more about the importance of sexual and reproductive health education? I know you talked with us about the program that you all implement, but just tell us a little bit more about just how important that is and how you see that work playing out as a minister.
Definitely, absolutely. I think that it's oft repeated, but I think it's important to say, with education there is power, and there is a power to understanding one's physical body, to understanding one's reproductive choices, and there is a power in learning about respect for oneself and respect for others in loving relationships. And sexual education allows for more information. And, the idea that to withhold information is healthy it seems completely odd to me. I mean, really the idea is if you're able to give individuals information to make healthy choices, the hope is that they will. And that's where I think some of the issues with abstinence-only education, we're not allowing the youth and also young adults to understand that they have choices in this world and to make safe and responsible ones for their God-given bodies. That's what's really important.
Thank you. Reverend Webster, can you share with us your thoughts on the need for age-appropriate sexual health education?
Well, I think I am blessed and benefited by having two health professionals in my life as assistants, one before Katrina and one since Katrina. The Reverend Audrey Jackson Johnson was my assistant, and she was a pediatric AIDS nurse and educator, and so part of our understanding on human sexuality came as she led our church in probably the first and maybe the only, Human Sexuality Institute done in a Black Baptist church, and we will continue that. Since then, I've had the benefit of having formerly as my assistant to the pastor, but now executive minister, the Reverend Dr. Kevin U. Stevens, who was formerly the health director of the city of New Orleans. And from both of them, we have been able to share with our congregation the kind of important things. Now, unlike my counterpart across the table, things aren't quite as simple as that in our church. For example, when somebody asks me, are you, let's find out now, are you pro-life or are you pro-choice? And my answer is yes. And they say, well, wait a minute, you don't understand. I'm asking which one are you? Are you pro-life or are you pro-choice? And I say yes again, because I'm pro-life, I'm pro-choice. And that's based on my biblical understanding. The scientific and medical understanding that I've received from the healthcare professionals suggests to me that in the notion of reproductive issues, there are certain scientific medical exigencies that supersede certain preconceived notions. You have the life of somebody in your hands. You have to go with what is the important medical issue there. So it's not pat and firm and neatly wrapped up. And of course, I base that on the Bible. But anybody can pick out texts and prove almost anything they want to with the Bible. So I'm not talking about proof texting. I'm talking about the sweep of the Bible.
Right. Thank you. So just tell us briefly a little bit more about your Human Sexuality Education Institute that you mentioned. We want our listeners to know about that education program at your church.
Well, in the hands of competent and qualified healthcare professionals, all of our people, our young people, starting out with them, and that's the focus, understand what the body is, what are the body parts, what are they there for, what's our best understanding of not only what they are, how they function, how to take care of them. And I guess I choose to talk not so much about reproductive freedom as I talk about reproductive responsibility. And I think it's a logical consequence, because with freedom comes responsibility. And if there's no responsibility, you really don't have true freedom. And so whatever it is that they exercise in options with choices that they make and decisions that they take, they really need to understand what they're dealing with. This stuff doesn't come from out the sky, doesn't grow on trees, and there are certain consequences to certain actions. And so biology, basic biology, how does this function, endocrine system, knowing what the systems are, how they function. And then some of the sensitive awareness that has to be shared with males, because this is not in your body. You have no idea what is growing and going on in the body of a woman. And we're not even to the birth, if that's where it gets, but to have some sense of what hormones do, how you can be supportive, what you do that doesn't help. It's a family thing, and it should never be done in isolation or against facts. But everybody has ideology. Everybody has their own theology. But what we try to do is balance faith and reason, religion and science, and there is not an inherent contradiction there. It's simply the overlays of interpretation.
Wonderful. Thank you so much, Reverend Webster and Reverend Roake. We certainly believe that lifelong sexual health education is an amazing concept. As a sexual and reproductive health educator for more than 15 years, I myself can definitely appreciate the perspective of sex education as a lifelong process. Here at Planned Parenthood, we believe that parents and caregivers are the best teachers when it comes down to educating young people on sexual and reproductive health, which is why we partner with those of you, the two speakers here today, Reverend Webster and Reverend Roake, to make sure that reproductive health is out in the community with faith-based organizations, community-based organizations, and community partners. We offer a program called Real Life, Real Talk, where we educate parents and provide them with the information and the tools that they need to have these very important conversations with the young people in their lives. We encourage everyone to get involved with the Real Life, Real Talk program, and you can get more information from our Planned Parenthood website on how you can contact us and make sure that we are available to have those sessions within your community-based organizations or your faith-based organizations. Again, I think that Reverend Roake and Reverend Webster have done an amazing job talking about the importance of reproductive health within faith-based environments, and I just want to make sure that we have allowed them to speak in ways that have captured how passionate they are about this issue. And so, Reverend Roake, do you have any final comments for us?
Yeah, I would just say actually also I think that Reverend Webster and I come together on quite a bit on these issues, and I would say that I also agree that none of these are pat issues at all. And in fact, the movement for greater sex education, for the understanding of reproductive choices comes from an understanding in terms of my work. I was a hospital chaplain as well at Mass General Hospital, of being with people in these difficult decisions and understanding that the world is not simply black and white, that there's a lot of gray area, and that actually the job of a minister or a religious figure is to sit with people in these questions and help them find the best way, and in my belief, the most godlike way to move forward, and how to help make a life-affirming choice for the individual. And so, and often that individual is within a faith community and within a family, and how to help facilitate that support and that decision and that care and that love. And a lot of that has to do also with having the tools of sex education, having the tools of understanding who they are and how to respect themselves and how to respect others, and how to really bring forward love into this world. And that's what I think is really sacred work. And that I do believe that the work of educating young people and the work of supporting Planned Parenthood, for me, feels very much like sacred work.
Thank you so very much for that. We certainly appreciate your involvement with Planned Parenthood and your participation on our advisory council. And we're also looking forward to you participating with our upcoming lobby day, which I'll talk a little bit more about later. Reverend Webster, do you have any final comments for us?
Yeah, I guess Reverend is right. We do agree on a lot of things, but understand that my experience with Planned Parenthood doesn't go back a couple days, a couple weeks, a couple years. It goes back decades, and it has been the single resource that I could depend on to really do what it talks about: Planned Parenthood, family planning, before the fact, during the reality, after, and to reduce to single issue politics, vendettas against an organization that I think has saved the lives of untold thousands is well, it may not be unconscionable, but I think it's ill-advised. And so that's how I can be in favor of Planned Parenthood, will continue to be in favor of Planned Parenthood. But just like in anything, no one group has everybody but agreeing on everything, and that's okay. That's life. And so, but if we can pass on to this younger generation and then older folk who didn't get the information themselves, unfortunately, they pass on faulty information or the lack thereof of good information because they didn't get it right. So if this thing is holistic, the Greek word holos, which gives us both holy and whole, W-H-O-L-E, is, I think, the approach that any kind of education, sex education, reproductive, it's got to be holistic. It has to involve the entire community, the whole person, and the whole configuration of whatever iteration the family takes on.
I am so impressed with both of you, so grateful for your involvement with Planned Parenthood, and greater than that, grateful for your involvement and commitment to the community of New Orleans and the health of New Orleans, as well as the health of everyone in the state. We appreciate your partnership and your participation on our advisory committee, and we certainly appreciate you being here today. As I mentioned earlier, Planned Parenthood provides sexual and reproductive health education classes for youth with community-based organizations, faith-based organizations, as well as with parents. For more information or to schedule one of those information sessions, you can go to ppgulfcoast.org/myhealthmylife, or you can send us an email at laeducation@ppgulfcoast.org or lapublicaffairs@ppgulfcoast.org, and one of our expert sexual and reproductive health educators will get back with you.
Every Saturday night is Rhythm and Bounce with yours truly, co-DJ Black and Mild, right here on WBOK. And what's Rhythm and Bounce, you might ask? Rhythm and Bounce is for my mature twerkers and all my music lovers out there. We take all kinds of genres, from soul, R&B, dancehall, soft rock, anything, and put a little bounce behind it. So you get your two-step on and you'll mature on every Saturday night right here with yours truly, co-DJ Black and Mild, live inside of Rhythm and Bounce from 7 to 9 p.m. right here on WBOK. Real talk for real times.
Catch me, Reagan Carter, every Friday right here on WBOK from 3 p.m. to 3:30 p.m. on My Health, My Life, a new public affairs radio show hosted by Planned Parenthood Gulf Coast. My Health, My Life will highlight the healthcare challenges Louisiana faces and invite community partners to come on air to help us discuss solutions for making our state a healthier one. As the Senior Director of External Services for Planned Parenthood, I'm working with community partners and talking to lawmakers and people across Louisiana about how we can improve health care and health education in Louisiana. My Health, My Life will air on Fridays from 3 p.m. to 3:30 p.m. Tune into 12:30 a.m. or listen online at www.wbok1230am.com. For more information, please visit PlannedParenthoodGulfCoast.org/MyHealthMyLife.
Listen to the New Orleans Imperative, the only radio show in New Orleans that focuses on public education. Every Monday, 10 a.m., listen in, hear the real news, the New Orleans Imperative.
Follow WBOK on Facebook and Instagram at WBOK 1230 AM and on Twitter at WBOK 1230.
This is Reagan Carter with Planned Parenthood in Louisiana, and you're listening to My Health, My Life. Please join the conversation online by following us on Twitter at PP Louisiana, and don't forget to use the hashtag MyHealthMyLife. The 2015 Louisiana legislative session started this past Monday, April 13th. Tuesday, April 14th was National Equal Pay Day, the day that symbolized how long into 2015 women must work to earn what men earn for the same work in 2014. Thanks to increased access to reproductive health care, including birth control, more women than ever are in the workforce. Unfortunately, some workplace policies have not kept up with this progress. The fact that women are the primary breadwinners in more than 40% of the households with children, but are only making 78 cents on the dollar is unacceptable. For women of color, that gap is even higher, with African American women earning 64 cents and Latinos earning 54 cents for every dollar earned by a white man. Closing the gender gap is an actionable way policymakers can and should move forward to ensure women are given the tools that they need to succeed at home and in the workplace. One bill that we will be following closely this legislative session is the Personhood Constitutional Amendment introduced by Senator Elbert Guillory, who is a Republican from Opelousas. This proposed personhood bill calls for an election to add an amendment to the Louisiana State Constitution that provides personhood and full legal rights to a fertilized egg from the moment of conception. Planned Parenthood opposes this bill. The proposed bill inserts government in our personal lives and in particular into our most private and personal medical decisions. Planned Parenthood believes a woman deserves access to the full range of reproductive health care she needs, regardless of who she is or where she lives. This bill simply goes too far. The politicians in Baton Rouge that have proposed this bill are outside the mainstream of common sense thinking, and their motivation is clear. They clearly want to ban common forms of birth control, treatments for infertility, and all abortions, even when a woman's health and a woman's life is at risk. Voters in North Dakota, Colorado, and Mississippi have all overwhelmingly rejected similar personhood initiatives whenever they have been on the ballot. No personhood measure has ever been approved by voters in the United States. We will be sure to keep you posted on the latest developments in Baton Rouge and all the ways you can get involved to make sure your voice is heard. Planned Parenthood needs you standing shoulder to shoulder with us to protect access to reproductive health care. Join us in Baton Rouge for Lobby Day on Monday, May 4th. We're going to need dedicated, passionate supporters like you with us every step of the way. We will spend time that day visiting with lawmakers and talking with them about reproductive rights and reproductive health care. We'll also have a rally on the front steps of the Capitol, which will feature elected officials speaking and more. Transportation will be provided from New Orleans, Shreveport, Monroe, and Lake Charles. Our message is clear. Keep politics out of women's health. If you are interested in more information and to register for Lobby Day, please visit standwithlouisianawomen.org. Several other events we have coming up. Please save the date for May 15th, which is our annual New Orleans luncheon, which will be held at 11:30 a.m. to 1 p.m. at the Roosevelt Hotel. For more information and to buy tickets, please go to ppgulfcoast.org/NOLA. Thank you for tuning in to My Health, My Life. Join us next week as we talk about sexual assault prevention. Again, I'm Reagan Carter with Planned Parenthood, and you've been listening to My Health, My Life. Have a great afternoon.
When it comes to the voice of the people, we're the choice of the people. New Orleans' own WBOK 1230 AM. Real talk for real times.
Catch me, Reagan Carter, every Friday right here on WBOK from 3 p.m. to 3:30 p.m. on My Health, My Life, a new public affairs radio show hosted by Planned Parenthood Gulf Coast. My Health, My Life will highlight the healthcare challenges Louisiana faces and invite community partners to come on air to help us discuss solutions for making our state a healthier one. As the Senior Director of External Services for Planned Parenthood, I'm working with community partners and talking to lawmakers and people across Louisiana about how we can improve health care and health education in Louisiana. My Health, My Life will air on Fridays from 3 p.m. to 3:30 p.m. Tune into 12:30 a.m. or listen online at www.wbok1230am.com. For more information, please visit PlannedParenthoodGulfCoast.org/MyHealthMyLife.